everyone, today I am giving you information on the topic cataract. This is the cataract part 3 in which I will give you the explanation about the next eye exam which needs to be done before the cataract surgery. This is the very important and its name is dilate eye exam. In case of dilate eye examination, drops are placed in the eye of a patient to widen or dilate the pupil. Okay, if you can see here that this one is the eye and this one is the undilated pupil and this one is the dilating pupil. Okay, we'll put the drops inside the patient's eye to widen the pupil. Now in case of undilated pupil, before putting the drops, if we are going to examine the retina, then we'll put a light inside the eye of a patient. Only this part of the retina will be examined in case of undilated pupil. Okay, but by putting drops we'll examine the that much part of the retina. Okay, so this is very important to get the basic idea about what will be the output of the cataract surgery. That is why the dilating eye exam is important. Eye care professional examine each and every part of the eye including the retina to rule out the diseases, mainly in patients with diabetes as well as the hypertension. Okay, eye care professional examine the each and every part of the eye including the retina. Each and every part of the eye examination is very important to get to know about the complications of the cataract surgery. Okay, so it is very important in case of those patients who have a diabetic disease, who have diabetes as well as the hypertension or any kind of systemic illness, thyroid, asthma, diabetes, hypertension, as well as ischemic heart disease. All these are the systemic illness. Those systemic illness according to their age. As the age of the diseases become more, it will affect also the retina. Okay, there is a direct impact of age of these diseases on the retina, and they will damage the retina, which leads to a decrease in the vision. Okay, so this is very important to do the dilate eye examination before as well as after the cataract surgery also. After exam, the close-up vision may be blurred. Okay, after putting the drops inside the patient eye, the close-up vision may be blurred for some hours. Next one is, now if you can see that this one is the right eye of the patient and this one is the left eye of the patient. Okay, we will put a torch light inside the eye of a patient and will identify that this one is the dilate and this one is the undilated pupil. Okay, so in case of dilating pupil, we will examine the retina like this. Okay, the retina appears at this by using indirect ophthalmoscopy or the direct ophthalmoscopy. The retina will be seen. Okay, now in case of normal retina, optic nerve is present. Okay, this one is the optic nerve. Retinal blood vessels starts coming out of this. These are seen, and next one, this area is the macula, and inside the macula there is a fovea. At the fovea the image is formed. Okay, so this is the condition of a normal retina. Normal retina will appear like this. Okay, if there is a normal retina in case of a patient, then we will give the surety to the patient that the vision will become after the cataract surgery will be very good. Okay, there will be no complications or no any kind of disease in those parts of the retina. Okay, so let's see what will be the case in diabetic patient. Okay, when a person have diabetes, high blood sugar level are usually high. Okay, the blood sugar level in case of diabetic patient is usually high. This can leads to the damage of small blood vessels that are helpful in nourishing the retina. Okay, we have seen here that the blood vessels are present in the retina. Okay, these all are the blood vessels. So if the diabetes of a patient remains uncontrolled for a long time, then this will lead to the damage of these small blood vessels which nourishes the retina. Okay, these blood vessels are very important in nourishing the retina and helps to maintaining the vision in case of patient's eye. Consequently, once the blood vessels are damaged, the eye attempts to grow new ones. Okay, so when there is a damage of the blood vessels takes place in case of diabetic patient, the new blood vessels starts growing in the patient eye. Okay, but these are tiny blood vessels, they will not grow properly and they will starts to leak in between. Okay, leakage of a blood takes place in case of uncontrolled diabetic patient which remains in the body of a patient since a long time. Okay, so this is known as a diabetic retinopathy. The retinopathy means there is a damage of retina due to diabetes. That is why it is known as a diabetic retinopathy. Okay, this one is the normal eye, if you can see here, and I have already discussed in the normal retina what is the normal retina. Now in case of diabetic retinopathy, what changes takes place? Newly blood vessels are formed. Okay, new blood vessels starts growing in the retina of a patient. Hemorrhages, the word hemorrhage means there is a leakage of a blood from these new blood vessels. Okay, leakage of a blood takes place. And microneurmus, these are also seen in case of diabetic patient. In case of diabetic retinopathy, new blood vessels starts growing in the retina of a patient and it starts leaking, due to which the hemorrhage is seen in case of a retina. Okay, so if a patient have these kind of systemic illness, these needs to be controlled properly. Okay, strict blood sugar control is advised to the patient before as well as the after cataract surgery. In case of hypertension, now in case of high blood pressure, what will happen? High blood pressure also damages the retina. It refers to the fundus changes occurring in the patient suffering from a hypertension. Okay, different kind of fundus changes are also seen in case of hypertension. Hypertensive retinopathy is an eye condition in which high blood pressure damages the retina. High blood pressure means blood is pushing with more force than normal against your artery walls. Okay, in this case, the blood pressure will pushes the blood inside the vessels with more force as usual. Okay, these kind of changes takes place in the hypertensive retinopathy. Okay, let's see. Hard exudates are present. These dots, whitish dots are present. These are the hard exudates which we can see in case of hypertensive retinopathy. Next one is the cotton wool spots. These are the cotton wool spots. Okay, these are bigger and hard exudates are smaller. Next one, flame shaped hemorrhages. Hemorrhages is again the leakage of blood, but these are flame shaped. Okay, so these kind of things are seen in the fundus of a patient who have a hypertensive retinopathy. So these are the systemic illness. If a patient have any kind of systemic illness, it is very important to do the eye examination yearly as well as to control these systemic illness. Next one, biometry. Now what is a biometry? Biometry is the process of measuring the IOL power. Okay, IOL power is a kind of lens which IOL is a lens which needs to be implanted in the patient eye at the time of the cataract surgery, because while doing the cataract surgery we are removing the natural lens and placing the artificial lens in the patient eye, and the biometry is possible with the help of two powers are needed. First one is the keratometry, which is the corneal measurement, horizontal as well as vertical measurement of the cornea as well as the axial length. Axial length is basically the length of the eyeball. Okay, now what is IOL? IOL usually consists of a small plastic lens with plastic side stoots called haptic to hold the lens in place in the capsular bag inside the eye. Okay, now this one is the IOL, intraocular lens. This the lens of a particular power is placed in the patient's eye so that he or she is able to see after the cataract surgery. Okay, now these haptics are there. Okay, these are known as haptics or stoots which you are looking here. These are supposed to be stuck in the zonular fibers of the patient eye and the patient is able to see clearly. Okay, IOL are conventionally made of inflexible material PMMA, although the lens are largely been supersized by use of flexible materials such as silicone and acrylic glass. Okay, PMMA is basically a hard material. Okay, the lens is made up of this material and the lens look like this. It is made up of polymethyl metaacrylate material and it is a hard material. Okay, next one is most IOL fitted today are foldable fixed monofocal lenses matched to the distance vision, but nowadays foldable lenses are available. Okay, now this one is the lens and in foldable condition it appears like this. Okay, the benefit of the foldable lens is this, that uh, we put a will put an incision here, small incision here, and insert the foldable lens inside the eye. Okay, but if we will use the PMMA lens, which is a hard lens, we are supposed to give a big incision here, then we'll insert the lens. Okay, so this is the benefit of the foldable lens. Nowadays the foldable lenses are also available, which will match to the distance vision. Okay, which will correct the distance vision properly, and we have to wear the glasses while looking at the near vision, while using the mobile phone, while using the computer, while reading books. We are supposed to wear the glasses, but they will correct the distance vision properly. However, other types of lenses are also available, such as multifocal lenses that provide the patient with multiple focused vision as the far reading distance, and adaptive IOL that provide the patient with limited accommodation. Okay, this one is the multifocal lens. Okay, in case of multifocal lens, these rings are appeared. Okay, so these rings will help us to focus at the distance as well as the near vision. Okay, this one is the image of the eye, in which after dilatation the lens inside the eye appears like this. Okay, these rings are seen, so this one is the multifocal lens which is placed inside the patient's eye. Okay, this was the end. Thanks for your patience listening.